But I think it's important for the inquiry to remember that for those families, the pandemic, the issue of COVID has not gone away. So there are still issues with regards to access to services. I'm thinking also of children who are critically vulnerable, children who are disabled, children who have special educational needs and disability, and the long-term impact this is having. So during the pandemic, and when my colleagues were speaking there, I was thinking back to what children told us. So they told us that they were lonely, they were isolated, their anxiety was getting worse, and mental health was getting worse, and those trends have continued. So if we look at mental health as an example, was the devastating impact that mental health had, the devastating impact that the pandemic has had on the mental health and well-being of thousands of children in Northern Ireland and across the UK. And the harm is undeniable, and it has been well versed within this inquiry. I'm very frustrated that there's no clear government recovery plan, and we will come to that later, I hope. But in terms of mental health and how it has digressed in Northern Ireland since the pandemic, we now know that a report published by the Mental Health Champion and Kids and Young Persons Life and Times in 2023 showed us that mental health among 11-year-olds is at its lowest point since 2010. So that's children who are in primary 7. We also know that among 16-year-olds, nearly half of the young people that we know of are experiencing a probable mental illness. And there's disparity amongst boys and girls. So girls would be disproportionately affected with regards to probable mental illness. And when we think about the worry and the fear that children experienced, so we can see that worry and stress has intensified, with only 6% of 16-year-olds saying that they never feel worried, compared to almost 1 in 5 11-year-olds. And why that's important, I suppose bringing a real life story to this is important. 2 days ago, a mother spoke on the radio in Northern Ireland about her children who have special educational needs and who haven't, they're not experiencing services and support that they might have. But the anecdotal evidence that she gave on the radio was that child, one of her children, was afraid to let Santa Claus into the house during the pandemic, because by Santa coming to visit that house, he could have spread the pandemic, and that child was afraid of someone in the house dying or that child passing on the virus. So that's quite shocking that children are still experiencing that fear, and I think we need to talk about how we wrap support around children and young people to mitigate against the harm that the pandemic had done and is continuing to do. There are many reasons. I referred earlier to how we made all these decisions about children without adequate planning. And one of those decisions was to close schools and to educate children online. So children had no choice but to be educated and also to socialise online. And there's a balancing act here. We did see how the online world can be very positive for children. But what we done was we accelerated everything. Microsoft Teams, Zoom, they weren't really in our vocabulary. Now these things are part and parcel of our day-to-day, and they're part and parcel of children's education. But what we didn't do when we pushed young people online was put the adequate safeguards around them. And it's very, very difficult, in my opinion, to turn the tide. So we know that people spend excessive time on screens, and we know that this is particularly damaging for young people and children. And we are seeing now a clear link between excessive screen time and mental ill health and well-being. And I suppose when we look at all of that through the lens of child's rights, and we reflect upon what the UN Committee on the Rights of the Child have told us, is that we need to view the online world like we do the offline world, and the children should be fully protected in both of those spaces.